Hey guys, it's Jason from BodyWorx Physio. Here today to do a really quick video on the different types of strapping tape, how they can be useful for you, and some of the precautions and that with each tape. So we've got 4 different types of tape lined up here. So we've got our, first up we'll go through our rigid strapping tape, our dynamic tape, our hypersensitive tape, and what we call our EAB, or our elastic adhesive bandage. So we'll go through each of these. So first up, we've got our rigid strapping tape. So most commonly, common size is 38 millimeters, and it's usually coming in brown. You can sometimes see it in white and a few other colors, but you're most commonly going to see it in brown. It has pinked edges, so you can see the little striations in the tape there. It means it's easy to tear with your fingers. The precautions with this are you don't want the edges of this to be across joint lines. So if you're taping an ankle, you don't want the edge to end on the front of that joint line, because otherwise it can tear. Same through the skin, same thing at the back of the ankle on the Achilles. The rigid tape's really great for resisting movement, so it's really good for supporting ligaments, like the ligaments on the outside of your ankle, or really holding a joint in place, like when you're wanting to stop shoulder dislocations or subluxations. The adhesive on this tape can be a little bit irritable on sensitive skin. So if you are allergic to tape, allergic to band-aids, or if you think the skin is going to be a bit irritable, especially if you're leaving that on for a few days, you can use the hypersensitive tape underneath. This stuff's a lot nicer on your skin. It does move a little bit with the skin, so it gives it that better stick. Normally we say with the rigid tape, if you're leaving that on in a non-sensitive area that's pretty tough and you're not allergic to it, you can leave it on for 2 to 3 days quite happily. With the hypersensitive, you can leave it on for another day or two longer, or if you're sensitive to band-aids or that, you most definitely have to use this underneath. Some people are still allergic to the hypersensitive tape, so do bear that in mind. And next one is your dynamic tape, and it comes in a range of colours and brands and different patterns and that. I would normally say, like most things, the generic actually does everything that the fancy brands do. It just doesn't come in pretty colours. When you're doing this, if you're getting it off a roll like this, if it's not coming pre-cut, always try and round the corners. That just means the corners aren't going to lift up as much. Pulling it off the strip is just tear it in the middle, and you see it tears off nice and easily. Remember, when you're putting dynamic tape down, you want to stick down the first inch or couple of centimeters, stretch. Sorry, get the bit of paper off the back before you do that. So stick down the first inch, stretch, and then stick down the last inch. And we're looking to do, about a 50% stretch. And then our last one is our EAB, which is our elastic adhesive bandage. So it's stretchy, and it's got adhesive on it, adhesive elastic. Most of the time you'll be able to get the hand tearable ones. I would recommend, if you're working with a sports team, always get the hand tearable, because trying to cut them with scissors while you're on a sports field is just a nightmare. So those are the 4 main types of tape. You can also sometimes see various brands of adhesive underspray. So if you've got something like you're taping a shoulder, I find that's really useful to stop it coming off when people get sweaty. So you spray it on, let it dry, and then apply your tape. It's a little bit protective on the skin, as well as it helps it stick better. So those are your 4 types. You've got your rigid, which is great for ligaments and joints. Our dynamic, or our proprioceptive, also sort of like glad wrap with adhesive, and it's great for doing proprioception, for postural feedback, for supporting muscles. Our hypersensitive, which is good if you have any skin sensitivities or you want to leave it on for long. And our EAB, which is basically just an overwrap. So I hope that helps. Have a look, and there'll be more stuff on how to do specific joint taping on our YouTube and Facebook page. Thanks, and have a great day.